Now that we are talking about a silent pandemic, AMR, how can we not talk about COVID? And that takes me to my next question. These days, the situation is such that there's a little outbreak and all of us panic. It's like, this is going to be the next COVID pandemic, a pandemic of sorts. So what do you have to say about it, in terms of COVID, what are the key lessons that we have learned, the government has learned, and how are we preparing for the next possible pandemic?
Right. So COVID was a global emergency, and I think India handled it pretty well in whatever way it was. We had glitches, we had many setbacks, yet I think the diagnostic capacity improved in the country a lot. From 50 or 100 labs, VRDL labs overnight, to almost 3,000 labs doing the COVID tests in the entire country. I wouldn't say it was a small feat. It was a big leap for the country.
Yes.
And the other thing was that the communication initially was a problem, because nobody knew about the virus, how the virus is progressing, right, how what the treatment is going to be, how are we going to prevent the transmission. So to start with, I would say the communication was a little challenge, but over a period of time, I think all of us understood, how to prevent, how to protect ourselves. I know many people who did not get COVID at all.
Yeah.
Through so many waves. It could be inherent immunity as well, but yet I think there was a lot of communication. And even you would recall, when we were young, there was a lot of communication on radio and TV around how to prevent diarrhea, how to do oral rehydration.
Yes.
So I think that will be the key going forward. Government is investing and strengthening the district hospitals. I have myself led the coalition of national essential diagnostic lists, that what are the minimum set of diagnostics which should be available at all centers of healthcare in the government system. Right. And government is actually putting all resources to make those diagnostics available, whether it's a PHC, CHC or a district hospital. So the government is trying to improve the systems, but at the same time, I think there should be more alertness in terms of communities. One thing is that there's a lot of hype which is created by social media. That is something that we should try to avoid and go by the facts. And that is where I think the role of communication becomes very important. Right. Diagnostics I already talked about. And the other thing which we learnt around COVID was that we had very quick real-time availability of data because of the digitization. Right. And with so much focus on digitization, I think it will go a long way in terms of how quickly we are able to share data between the states to the center, and based on that we can actually launch a more informed kind of a response. So these are few things. Besides that, I think the governance was the biggest issue with COVID, which I think all public health programs can benefit from. Because this program was monitored by the PMO and the Home Minister himself, that made a lot of difference. The funds were made available, the systems were created to implement it better. So all public health programs, I think, can benefit from this kind of focus going forward.
Yes.